Hello everyone, welcome to my video. We're going to discuss sickle cell anemia in medicine and medical nursing. Alright, so your presenter here, Henry I.E. Stay tuned and watch this video up until the end. Let's proceed. So we're going to discuss this condition with the following objectives. We will define sickle cell anemia, sickle cell crisis, and we're also going to discuss the 5 predisposing factors, the types of crisis, 5 problems on the nursing care plan, and complications of sickle cell anemia. And lastly, we're going to look at the I.E.C. Let's start. Sickle cell anemia can be defined as a severe hereditary form of anemia in which a muted form of hemoglobin distorts the red blood cell into a crescent shape at low oxygen levels. All right? What this means is the 6th amino acid in the beta chain of a normal hemoglobin molecule is replaced by the first amino acid, which is valine, this one here, illustrated in this one. So glutamic acid has been replaced by the valine, which is here. We proceed. What is sickle cell crisis? These are periodic episodes of extension cellular sickling with sudden onset or severe painful acute exacerbation red blood cell sickling causing a crisis. That's how you can define a sickle cell crisis. What are the predisposing factors of sickle cell crisis? So predisposing factors of sickle cell crisis are illness, exposure to cold, stress, dehydration, extreme fatigue, and hypoxia. Illness. What you can explain on illness is that illnesses such as malaria, which are characterized by hemolysis of red blood cells or erythrolysis. This causes a reduction in oxygen carrying capacity and leads to a crisis. Exposure to cold. What you can explain here is that exposure to extreme cold temperatures causes constriction of blood vessels. Hence, this increases the chances of occlusion by sickle-shaped cells. Then we have stress. Stress increases oxygen demand. This will cause hypoxia and lead to crisis. Dehydration. When a patient or a person is dehydrated, blood becomes viscous or thick, and the thickness in blood increases the rate of agglutination of sickled cells or sickled cells. By that I mean the red blood cells that are sickle-shaped begin to attach and agglutinate. Hence, this can cause blockage of a blood vessel that supplies a vital organ and cause crisis. Extreme fatigue. Extreme fatigue, similarly to stress, increases demands for oxygen. Hence, this will lead to a crisis. Lastly, hypoxia is a state of low oxygen in circulation, and because of that, there's going to be a crisis, or moreover, there's already a reduced oxygen carrying capacity because the sickle-shaped cells cannot carry oxygen because their shape is dysfunctional. Having looked at the predisposing factors, let us quickly go to the types of crisis. So we have 4 types of crisis. We have vaso-occlusive, aplastic, acute sequestration, and lastly, hemolytic crisis. So vaso-occlusive crisis is also known as infarctive crisis or painful crisis. This type of crisis is a crisis that occurs when occlusion of a blood vessel leads to disturbed circulation to vital organs, hence leading to loss of consciousness and leading to a crisis. Aplastic crisis is a type of crisis that comes as a result of bone marrow depression or bone marrow suppression, in which the bone marrow is unable to produce enough red blood cells to replenish or replace the destroyed red blood cells. Remember, sickle-shaped red blood cells are destroyed by the spleen, and because there's increased destroying of red blood cells or destruction, the rate at which the bone marrow produces them when it is depressed is reduced. Hence, there's going to be a crisis. Also, acute sequestration. Acute sequestration is a type of crisis that occurs when there's pooling of blood in the spleen. So the spleen begins to pool blood it begins to withhold blood from circulation, and this reduces the volume of blood. It causes hypotension and it leads to a crisis. Lastly, hemolytic crisis. This is a type of crisis that comes as a result of increased rate of destruction of red blood cells by the spleen, hence leading to a reduction in oxygen carrying capacity, causing a crisis. We proceed. This is a summary of the sickle cell types of crisis. We have vaso-occlusive, aplastic, splenic, acute sequestration, and all those. So you can pause the video so that you can quickly run through them. We proceed. Signs and symptoms. Signs and symptoms include pallor of mucous membranes. This is due to hypoxia. Chronic fatigue is also due to hypoxia. Dyspnea on exertion because of reduced oxygen. Joint swelling. This comes as a result of blockage of blood vessels, causing stasis of blood, seepage of blood into the interstitial spaces, hence causing joints to swell. And lastly, aching bones. This is due to hypoxia, and when blood vessels supplying the bones are occluded, this is going to cause a very painful sensation due to tissue hypoxia. Having looked at the signs and symptoms, let's quickly look at the nursing care plan. 5 problems. The first one is painful joints. Painful joints. Painful joints related to tissue hypoxia secondary to occlusion caused by sickle-shaped cells, evidenced by patient verbalization. Our goal: the patient will be relieved of pain within 2 hours of nursing intervention. Our interventions. Firstly, I will assess the level of pain by using a scale of 1 to 10 to assess and employ appropriate nursing interventions. Secondly, I will nurse the patient in a comfortable position or position of preferred comfort and adequate rest to relieve pain. Thirdly, I will provide diversional therapy to distract the patient's mind from pain. Lastly, I will administer prescribed analgesia. You can give an example of either paracetamol 1 gram to relieve pain. Our evaluation. The patient exhibits cessation or a reduction in pain, evidenced by patient verbalization. That's problem number 1. We proceed to problem number 2, impaired gaseous exchange. So impaired gaseous exchange related to reduced oxygen carrying capacity, evidenced by reduced oxygen saturation of a reading less than 90, for example, 89%. Great. Our goal: the patient's gaseous exchange will be normalized within 20 minutes of nursing intervention. Our interventions. Intervention number 1, I will assess pulse oximetry to ascertain the level of hypoxia. Secondly, I will position the patient in semi-Fowler's or propped up position to promote lung expansion. Thirdly, I will administer humidified oxygen by mask or by nasal catheter, 4 to 6 liters to promote tissue perfusion. Lastly, I will administer intravenous fluids to reduce viscosity of blood and promote tissue perfusion. And now we go to anxiety. Pardon me. We're going to our evaluation. The patient's gaseous exchange has been normalized, evidenced by a normal reading of oxygen saturation of 97%. Then you're done. We go to anxiety. So anxiety related to hospitalization and unfamiliar ward routines, evidenced by patient repeatedly asking questions and restless. Our goal: the patient will be relieved of anxiety or allayed of anxiety within 2 hours of nursing care. Our interventions. Firstly, I will introduce myself to the patient in a calm manner and a soft approach in order to promote cooperation and allay anxiety. Secondly, I will explain all procedures done on the patient to allay anxiety and promote cooperation. Thirdly, I will orient the patient to ward environment and ward routines, or explain the tubings and instruments around the patient's bed to allay anxiety. Lastly, I will allow the patient to ask questions and encourage the patient to express their concerns in order to allay anxiety. All right? Our evaluation. The patient has been allayed of anxiety within 2 hours of nursing care, evidenced by patient no longer repeatedly asking questions. Right, we go to risk of physical injury. Risk of physical injury due to, this is our nursing diagnosis, risk of physical injury due to painful joints and restlessness secondary to hypoxia. All right, our aim. The patient will be prevented from sustaining physical injury throughout hospitalization. Our interventions. Firstly, I will nurse the patient in a railed bed to prevent injuries such as falls. Secondly, I will pad the rails to prevent injury in episodes of restlessness. Thirdly, I will administer prescribed analgesia to relieve pain and prevent injury. And fourthly, I will provide and bring nearby all necessary items the patient might need. I will provide a bedpan so that the patient will not have to walk going to the toilet. All right, with those said, we proceed. Lastly, our evaluation. The patient has been prevented from acquiring physical injury throughout hospitalization, all right, evidenced by absence of any deformities. Lastly, we look at the risk of infection. Risk of infection is due to hospitalization. That is our nursing diagnosis. Our goal, the patient will be prevented from acquiring hospital-acquired infections throughout hospitalization. Our interventions. The patient, I will wash hands at all intervals of nursing care to prevent cross-infection. I will change bed linen whenever sought to prevent infection. I will bathe the patient, either an assisted tub bath or a bed bath, daily to prevent accumulation of microorganisms on the patient's body and promote comfort and prevent infections. And also, I will disinfect all surfaces to prevent accumulation of microorganisms and prevent infections. And lastly, I will administer prescribed prophylactic antibiotics to prevent infections. Evaluation. The patient has been prevented from acquiring infections throughout hospitalization, evidenced by absence of new symptoms. Having done that, we're done with the problems on the nursing care plan. We proceed to the complications. So complications, we have congestive heart failure, pulmonary hypertension, acute chest syndrome, renal failure, autosplenectomy, and lastly, cerebral vascular accident, aka stroke. Let us start with congestive heart failure. Congestive heart failure can occur due to ischemic episodes leading to enlargement. All right? Pulmonary hypertension. This can come as a result of pulmonary infarction, causing stasis of blood in the right side of the heart, leading to increase in pressure. Causing pressure in the left side of the heart, and in left side of the heart, causing increased pressure in pulmonary vessels. Also, acute chest syndrome is characterized by fever, chest pains, cough, and dyspnea. Dyspnea is due to reduced oxygen levels, and this will cause chest pain, this will cause cough because of pulmonary hypertension, which will cause pulmonary edema, hence acute chest syndrome. Renal failure. This is due to injury to the kidneys as a result of reduced oxygen supply and increased blood viscosity to the kidney. Also, autosplenectomy. This is when the spleen becomes small due to repeated scarring. Remember, in sickle cell anemia, the red blood cells that are sickle-shaped are constantly destroyed. This causes the spleen to enlarge, and healing and inflammation may result to scarring. Hence, there will be autosplenectomy. Lastly, stroke. This is due to thrombosis and infarction of cerebral blood vessels. What this means is, when there's occlusion of a blood vessel that supplies blood to the brain, there's going to be cerebral vascular accident, also known as stroke. Having looked at the complications, let us now look at the I.E.C. Information, education, and communication. Firstly, talk about medical follow-ups. in order to monitor the progress of disease to see if whether or not the patient is recovering or it is worsening. Also, avoid infections. Talk about the patient washing hands and avoiding being in crowded places, and also disinfecting all surfaces in their toilets, their sinks, and the like. This I.E.C can be on discharge, and also I.E.C to the patient and the family. Avoiding stress, because stress increases demand for oxygen and can cause a crisis. Also, talk about seeking counseling on childbearing, all right? They can see genetic counselors because sickle cell is a hereditary condition. It can be passed on to children. So, seeking counseling tests can help the patient to better find a partner whom to marry, and also what to do on childbearing. And also, drug compliance. Talk about the patient not self-medicating. Tell them not to take drugs that are not prescribed. Tell the patient to take drugs on the right time. Tell the patient to report signs of adverse reactions. And also tell the patient to follow instructions, all right? Then also, we'll talk about the diet. A balanced diet containing proteins, carbohydrates, and vitamins from locally produced foods, right? That is, we look at prevention of crisis. Tell the patient to avoid cold places. Whenever the patient feels symptoms of malaria, they should report. And also, the patient should also avoid stressing, as I said earlier. Followed by rehydration. Remember, dehydration is a predisposing factor to sickle cell crisis. So, rehydrating helps reduce blood viscosity and prevent crisis. Lastly, keeping warm. Exposure to cold predisposes a patient to crisis, and that can cause the patient to go into a crisis. So you tell them to keep warm, wearing warm stuff, avoiding being in the cold, and also anything else you can talk about warming. For example, taking a warm drink and avoiding cold beverages. With that having said, ladies and gentlemen, this marks the end of our discussion. Thank you very much for watching my video. See you next time in our next video.